All right, I'm gonna call this meeting to order. I'm assuming we go, sorry, review of the agenda. We don't have any changes to the agenda. Do we have a motion for approval of the July meeting minutes?
I move we approve the minutes.
I second.
Any discussion? All those in favor say aye.
Aye.
Aye. Motion passes. I'm assuming we have no public comment. All right, we will move on to the fiscal year 26 budget. I'm gonna turn that over to you, Brandon.
Oh, okay. So, if you look at it, we actually got, our $92,000 from the CDC infrastructure grant. So we are going to be awarded that. So that did get added back into our allotment. We have, we did make the changes that we discussed last month a little bit to adjust some of those numbers, especially on the, I think, the vaccine area to bring that number down. We did do an adjustment. We are looking at, changing some of the things that we have here as far as expenses. So that, and kind of also in our agenda there, but also, our insurance, moving away from PEIA, which, for anybody that doesn't know, PEIA is not it's a state insurance. Where we're at, it's a little hard for folks to get fully covered what they need. We can actually switch over to, we're looking at Blue Cross Blue Shield Highmark. It actually allows us to add in dental and vision and still save money. And cover everybody completely. Along with making some adjustments to our IT services, we've actually seen that, I think, talking our CPA, we've seen a massive increase in our IT services cost over this past year compared to the previous years. And we go through the office of.
I was gonna say that's through the state, isn't it?
Yes, and we have one individual within this whole region that does the office of technology. So we've talked with health advisors here in Shepherdstown, who I think do a lot of the stuff for the county, and it would actually cut our costs roughly in half, depending. That would also save us some financial aspects for tech refreshes that are much needed. Here in the near future, we have a couple, desktops and stuff that can't even update to Windows 11 anymore. Pretty sure a couple of them are from 2001. So rolling that in, kind of made that adjustment on the operating expense areas. We have looked at some of the personnel areas of people that need increases in pay due to time here. They're getting their pay raises plus adjustments for our sanitarians, and also in the extra sanitarian position that we have open right now, still on the books and covering that. So, and then also bringing in another office assistant, so that personnel budget will change. Again, the operating, that personnel budget, it's on there though, still has PIA. We haven't made that adjustment yet because we're still in the process of that. But I think we're running about looking at $22,000 deficit, $21,000 deficit, I think. 24, I was off by, sorry. And got home at 2:00 this morning. I still function on caffeine and adrenaline. So I think it's much more manageable than what we've seen in the past budgets that have been put out. This also, that deficit could not be that large depending on how the savings on our insurance, the savings on our IT. We are looking at also changes to some of the operating expenses as far as which is cheaper, sanitarians renting a car out to go out or paying them mileage and the gas and things like that. So we're looking at all the different areas to save on the back end there too as well. So we're hoping that deficit is not that deficit come the actual end of the year and what's looking.
So this number doesn't include the Blue Cross Blue Shield?
No, it does not.
Or IT contract savings?
No, we're not. It does not.
Okay,
So those are
potential.
things we're
Well, we're working on.
looking at whether they're the best deals.
Yes, yes. So the areas, again, we're trying to make sure that we're doing the best we can for our employees, best we can for the especially for healthcare coverage, let's be realistic. And because where we're at with
Have you talked to staff? Like, do staff want to, are they good with leaving PEIA and going Blue Cross?
So we have been having some, so we've had some surveys out and asking, you know, especially with things of, coverages and things like that. There has been talk with the staff. I think the most hesitancy is making sure that they don't have a gap in coverage. Which we will do everything we can to make sure that doesn't happen. If we go to Blue Cross, there is an individual out of Hedgesville that would come in, set everything up for us, get everybody enrolled, be that kind of that middleman for us that would be able to make sure that we don't have a gap in coverage and everybody's good to go.
And we can do that mid-year or whenever.
Whenever we decide to pull that trigger, we can go ahead and do that.
And we don't have, or with PEIA, there's not a local
Correct.
agent or any agent, any corporation we deal with.
There's a phone tree.
I just think with PEIA, one of the, from what I understand, is like you can't even use out-of-state doctors or medical services, which living here, you know.
That's a big issue.
Yeah, so you can do them, but your co-pays and your percents
Right,
get big high.
yeah, exactly.
And they average an increase in our cost about 14% every year.
Hmm.
So, you know.
Just curious, I'm sure this was explored, but like the rest of the county, what insurance are they on?
So,
Is there any opportunity?
Yeah, so the county actually runs off of a lot of the agencies actually run off of Highmark Blue Cross Blue Shield.
So
So
this is kind of more in alignment with the county
With the
by
county.
going this way.
yes,
That's helpful, thank you.
So as we move to their building with IT also, you know, want to stay with the state IT. Berkeley changed to their county commission. Now that's not been without bumps also, but if we're gonna be in their building, they're gonna want to have one cybersecurity system and all that, so this would be a transition that we need to do anyway.
Also aligns with the
Yeah.
county.
yes.
It
Actually,
seems like two really smart options.
And then we may ask them, you know, if they can cover some stuff as in kind.
It'd be much easier if it's the same vendor.
yes,
Yeah.
yes. And the hope is to make things also, like I said, more affordable for us, easier, more readily available when we have issues and updates and things of that nature, and also better coverage for the employees, you know. People have families, people are trying to start families, people are, you know, at different stages of life and they need different things. And you never know when an emergency happens, right? Like, you know, even saying my son fell off and broke his arm on an Easter Sunday just because, you know, like those things happen, you never know. And so having the best available coverage for our people when they need it is, I mean, that's something I kind of a important area for me on that one, so.
Any other questions on this?
A lot of good work.
Yes,
I
thank you.
appreciate it.
Is there a motion to accept the revised budget for FY 26?
Move we accept the revised budget for 26.
I second.
Discussion? All those in favor say aye.
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 All right, motion passes. I'm just switching through, flipping documents here. Bear with me. All right, we're gonna go into new business, fiscal year 24 audit.
Yeah, so we had our audit finally for fiscal year 24, we sent out. It's the mass of paper, I apologize, it was done very differently, no one came in, they actually did it virtually. I do believe they didn't find any.
I didn't read
Oh,
it.
right, sorry. You know, we're going to go with the same individuals too for our fiscal year 25. The report, sorry, I was running a little late on printing off everything. It was massive amounts of paper to paper on printer.
Caffeine and adrenaline.
Being an adrenaline. You know, trying to get everything up and running. But
Thank you for emailing them, Alexis, as well.
yeah, I don't believe that there were any real findings that come from the audit, so I think we're looking. That's a positive in my eyes, so.
And so this is the semi-final
Yes,
version. They
yes.
just send us the final version, which we don't have any reason to expect to change, but I don't think we can set this a report yet.
Okay,
Yeah.
So the report's actually for the board.
right.
So
But we should have the final next month.
I,
You can accept.
so, because we also have to send it to the auditor
Okay.
and the county commission wants it since.
So we need to have it approved by our board before it goes to the auditor and county
I
commission.
don't know that part. And the accountant of the CPA firm will be sending it to the auditor also.
Okay,
Their own list. Or anything on this.
okay, so we'll wait till next month to formally accept this. Yeah, everything looks fine.
Then we hope that the fiscal year 5 is done maybe in October.
Yes,
And
that's
so
Back to the regular schedule.
that we already do have a contract with them to do that. So we're planning it out. That part out for time.
Thank you. All right, discussion of IT, HR, et cetera. I know you've just covered a lot in the budget side, but
No, it's like I said, trying to make that change, to a better infrastructure. Again, it makes more sense with the move, kind of in mind, moving forward the county buildings. The future move, but also, allowing us to get better coverage for the employees. For healthcare, and also allowing us to have more available IT services, save money, but also have something in here that is available for us at whenever we need it. And we're not waiting for anything like that. And then again, near future, very near future, we need to do a tech refresh on a lot of computers and updates, and it makes sense as with the move anyway, to be able to solidify that move and make it an easier transition.
all right, we'll move on to the financial update. Oh, sorry.
No, but human resources is listed here as well.
Oh, yes, so reach out to the county commission for the HR for the Jefferson County to see if we can possibly kind of roll in with them as well on that aspect. Again, moving over to the new building, being right there, having everything there. Because as we are kind of in this weird middle gap between state and county. But having something that is a little readily available for us for job postings. For if there's any pay raises, anything like that, setting pay rates, it'll be a lot easier for us. And a little more simplistic to go with the county. And if we can kind of again go in kind with the county and kind of be covered under their HR services as far as hiring, pay rates, pay scales, increases, that sort of deal.
What was the response?
I have not received one yet, but again, I've been off for the last couple of days, so I'm going through a lot of emails.
Just spoke with the administrator earlier this year, and she was receptive to the idea, but says you gotta talk to the
Process.
the human resources person. The three big advantages, first is that the system with the State Division of Personnel is all sorts of people, correctional officers, people at the state hospitals, or every position, and so they have to have rules that kind of fit everything. And then the pay scales they're looking at are really based primarily on the rest of West Virginia. And with every position, they have not just health departments in the Eastern Panhandle. So this is so out of line. Then you have special pay increases, which takes a while to get a few months. And so when we recently had someone leave here and go to Berkeley, we couldn't match the salary, they had just been given an approval for increased salary. We can't just say, will up you one, you know, like you could if it was a baseball player or something. Uh, the, uh, the processes for hiring are very slow in that it has to go through the state. So you can't quickly hire someone or just quickly introduce someone without follow-up.
Have to be like open for 30 days, then they review whether or not the person's eligible, and then you only get sort of the set of what they've approved, and then you go through the process, and then like it's becomes like a 60 to 90 day, assuming the first 30 days are you responded to, which we've had that challenge in the past, so.
It's not an agile system.
Yeah.
And then the third, and they're all important, this may be the most important, is when we have personnel issues, we don't have a counselor, you know, a human resources expert who can help us with it. You know, help us help the employee that understands the issues. And so the administrator has to become the HR expert. And when you need an expert, you need an expert, not just someone that says, I read the memo. And
There are a
nothing
lot
against
of,
you, but.
no, I totally understand. There's a lot of intricacies. There's a lot of things that, as everybody knows, especially, you know, FHA should. And the ones like, there's a lot of intricacies when it comes to employees and navigating issues and things of that nature. And, having, like Dr. Reese said, having that expert that is readily available as well. So we're not calling the state, we're not waiting for somebody to email back, we're not, you know, playing phone tag or email tag back and forth. Having somebody readily available for us, for those issues is very key. On top of the whole hiring thing, you know, we've had to post on the website, then we have to go email them to, hey, put this posting out on everything else if we're hiring a full-time employee. So we're at the whims of them on when they post things, and how they put things out too, and we could be doing that ourselves.
And the state can be very helpful with a lot of this stuff, but there's times when you just need informal conversations about a host of issues. And so that would be, and we have to, by law, we have to have an HR program. The DOP is the default one, but it says we can go outside of that.
What is the process to get outside of that? For some reason, I thought when we discussed this before, it was quite a process to get out of that.
I think you just, I don't know for sure. I think we just enter contract with them and that we have, you know, in place clear evidence that we have this process. Almost everybody uses DOP, because most health departments are quite small. One uses a federally qualified health center board with, I think a couple have their own HR, but they also get $1 million on. They can afford to hire an HR.
Again, with everything when it comes to the DOP, I feel that whether it's IT, HR, benefits, it is just switching over, making sure we have everything in place when we kind of in that contract, so to speak, with them, and we were not on a best I can call it is a month to month with them. Nothing is set in stone, so as long as we have everything set up in place, and again, making sure that we're not having any gaps in coverage, first and foremost, before anything else is helpful. And then we can, should be an easy switch over.
Sometimes you see.
I mean, I just hope that's easy anyway. You know, nothing is ever easy when it comes to the state sometimes.
Anything else? All right, we'll move on to Cox Holiday.
Woohoo, morning. All right, start with June. We have an unreconciled bank balance of 426,000. We're gonna take operating expenses of 451. And we are out of compliance by just under 25,000 for June. Or in the month of June, we had a revenue of 54,000. Subtract just under 98,000 in salaries and 22,000 in operating expenses for about $66,000 deficit. Fiscal year to date, which at this point we're 100% through the fiscal year, we had a total revenue of $1,420,000. That is about 7% below budget. Salaries, $1,345,000, which was 5% above budget. And operating expenses of $371,000, which was 6% above budget, for a deficit of $196,000. In accounts receivable, we have $269,000. 55% of that was the West Virginia Treasury at $147,000. Any questions on June?
We've gone to July.
Okay. All right. Beginning of new fiscal year, we currently have a bank balance of $517,000. We're going to subtract the operating expenses to $441,000 to have in compliance by $75,000. For July, which right now is the only month in the fiscal year, we have $167,000 in revenue. That's already up 3% from budget. Salaries of $101,000, which is on par with budget. And operating expenses of $8,000, which is 5% below budget. We did notice that the P card was not entered yet, so you will see an increase for that. We just don't anticipate that it will cover the entire surplus of $58,000 for July. All right, accounts receivable went down in July to $180,000. 32% of that being the West Virginia Treasury at $58,000. Okay. Questions for July?
I'll channel my inner Brandon over here. I know we've talked a lot in previous meetings about some of these really out of date collections. So have we made any sort of decisions on how to start to recapture that or to set up for future?
Yes, so MMS, I do believe is the not mere medical management solutions, sorry. I think there's an extra M in there. So they will be using them to help go for some of the outdated stuff that is to look at, make sure that what is collectible, what's not, and then we'll be writing off what we can. I think they'll have they do this, they deal with this. This is their wheelhouse. I think Dr. Lee had mentioned that we've used them before years ago. I think that's going to be our best solution. Try to even navigate the system of what can and can't be rebuild and what's outside of date and everything else. And we'll have to go with them and trying to see what we can kind of pull out of that. So I think that's what we'll get. I don't know. It's hard to really say as far as what's outdated in the billing section of what we can and can't get. But if we can even get a little bit of something, it's better than nothing.
When do we think we'll get them on board?
I'm going to start talking with them next week again. We talked with them before, and we'll just get them going. They're ready to go. I think we just need to. They were looking into making sure that they were still in our system and stuff. If not, then we'll get them up and running.
Will they actually pursue the collections efforts on
Yes.
things that they believe are?
Yes, they have the ability to pursue those collection efforts that they deem as.
How do they get paid? A
They
percentage?
take a percentage.
But there's really no upfront cost for us to hire them, just percentage.
Correct. We use them to do some of our COVID vaccine billing, which was $40,000 worth. So they just took a percentage. We'll have, good discussions, and we can loop you in discussions before they actually start billing, what they think is possible.
I really like the idea of having a third party looking at that and assessing potential before we make any decisions. That's wise. And just something to maybe consider, depending on how they do, is maybe a more longer term partnership with them where at day 270, and before it gets to that year, have them kind of playing cleanup, let your team do what they're doing, but having that as a backstop before things go over a year.
Yes, that, I agree with that. I think making sure that we're at least able to get what we can, even if it is a percentage of that after so long again, something's better than nothing.
Right.
And while we are, a public service to a point, we still need to keep the lights on.
Yeah. Is there a motion to accept June's financials?
I move we accept June's financials
Also the year-end financials.
and the year-end financials.
My second.
Any discussion? All those in favor say aye. Aye.
Aye.
Motion passes. Thank you. All right, moving into the agency activity reports, environmental. Alexis.
Great, good morning, everybody. I have good news today, which is that one sanitarian passed his final exam, so he's finally done training, fully released. And then the other sanitarian passed his exam a while back, but is completing his on-the-job training with the state officer today. This is his final day, so they will be fully released from the reins of the state as of today. So thank goodness. They are doing really well. The team is just really cohesive, really excited to tackle it. We did see a slight drop in the number of inspections, but we had kind of a lot of more difficult inspections that were a little bit more time consuming. We did have one restaurant closure related to a complaint about operating without water. That was very quickly resolved. They were able to get in there and get the water turned on. I think it was just some utility issue, but they were able to fix that, continue operating. We did see a slight increase in the number of septic applications. We saw a lot of development going on in the last month. We got a 50 lot subdivision and then I think a 7 lot subdivision. So we were pretty busy with.
They came in after July 1st?
Yeah,
Interesting.
we were busy. We kind of got slammed all at once. So the developers seem to be continuing. It's more so a lot of the repairs and add-ons to homeowners that are slowing down. Real estate's picking up. We saw a lot of well and septic information requests that actually doubled from last month, from 37 up to 67. So we were busy pulling records all month long. But yeah, we do have a trip being planned for next month. We're gonna go to, I think it's in Wheeling. Ogilvy for the Public Health Association conference. That'll be 3 of us to get our continued education credits for our licensure for next year. Do a little bit of networking with other sanitarians around the state, get to talk to them and ask questions about how they're doing with their programs. But yeah, we're doing pretty good. We had a good month, I think. It's been good vibes all around, so.
The sanitarians who are just finishing their licensure, their first week of class was it February 1st?
Yes, I think the first day of class was February 2nd. If I recall.
6 months.
Yep.
So we've been talking offline with staff, just as a heads up, and we'll probably have something ready for next month's meeting about some potential requested changes from the state on how we can help expedite on the front end, some of the training and so forth, in order for us to get more sanitarians in the pipeline, as well as some flexibility in terms of like retired, FDA commissioners or FDA personnel who have the training, but for some reason can't seem to work in West Virginia. It's actually the stuff that we follow. So,
And then the sanitarian that we did have that went to Berkeley County, she had held a license in Illinois as a previously licensed sanitarian there. But she had to go through the training here. So I actually reached out to her last week to see if she would resubmit to the Board of Sanitarians now that the new law has gone into effect to obtain reciprocity from other states. I wanted to have her go through that and see what the process was and what the results were of that. So she said she was going to do that. So I'll keep an eye on how that plays out, and we'll be able to have a good test of how the reciprocity will really work. Hopefully successfully. So
have you also reached out to the FDA person? as
Yes,
well To do the
yes.
same?
he's still interested. So hopefully he will be able to get his stuff together as well and resubmit. So we'll have, hopefully that will go through as well. Their next meeting is actually going to be at the Public Health Association conference. So we might have news. Actually, it'll probably be the meeting after, because I think that the conference is the week after our Board of Health meeting.
Okay. So is it reasonable for you guys to at least have a general outline for what we talked about
Yeah.
legislative by next month, and then take learnings from the health association meeting, and then?
Yeah.
Okay, perfect. Thank you. Any questions for Alexis?
Continued good vibes.
All right, move into threat preparedness.
So we actually had, some of y'all, they've known about the Charles Tower issue, earlier in the month of, or later in the month of July.
Mid-July,
What was it?
Mid-July, okay,
the roof came off of the Charles Towers.
yes.
Oh, yeah. I know.
So, thankfully, for the most part, threat preparedness, that issues are few and far between here, but, that was one of those issues where we kind of rallied around it. No one was injured. Big shout out to the nurses. I know, Lindsay will talk about this, but, I want to say big shout out to threat preparedness, under, Brandon, the other Brandon number 3. He was ready. He had the pod stuff ready to go if we needed to. Working with, did an amazing AAR afterwards, and really,
AAR.
After action review, my apologies, sorry. Yeah, an after action review, for the state, for us within house, and also setting up the state, of the theories that, went really great with a lot of turnout for the community, a lot of stuff. And like I said, I'll let Lindsay shine on that area over there. I apologize. But then on our end, working towards communication better with the emergency management, for the county. How the calls are supposed to go through, things like that. These are the things that we need to work on. Also, he will be going as well, I do believe, to the public health conference. There is a threat prep pipeline through there as well, along with the sanitary training. So all those are going on as well. So getting the grant submitted, it's been submitted for this fiscal year as well. So everything's going well in the threat prep area.
Right, no questions. I'll move on to clinical. Lindsay.
So just to piggyback on that, I was off that day, so
It always happens that way.
I know.
Always.
I came in, did a review, just trying to do an assessment of what's happening, and then called my nurses, and they were on point. They were there all day long, both Robin and Spring, helping out, doing whatever they needed to do. Very happy to see how the whole clinic really did get together. And although they were the only 2 on site, even back here, maintaining what was going on here, it was a good teamwork. But yeah, it was very good. And I'm really impressed with Brandon Wonder's work on how he gave us an in-house report. And it was very, very good. We haven't seen anything like that before. I've been here, this is my 3rd year, so I haven't seen that. So I really appreciated our collaborative spirit on getting a after event report done and going through it with everyone and things like that.
So what did the nurses do on site?
So, we collected information from all the patients, their medications that they needed, any particular diseases, highlighting diabetes, any medications that are, time sensitive. We had someone with seizure medication. So then Dr. Reedy was also involved trying to get someone to go get that from the apartments if people did not get their medication with them, to bring it for them. So coordinating that. A few people needed assistance moving around, helping them to the restroom and things like that. And then there was other things they were doing, just helping individuals, whatever they need, basically more collecting information and getting it to whoever needs it. And having that one-on-one contact with each individual who needed that.
The reports that came through Rotary were not nearly this flattering with how all of this was handled, and taking them, I guess, to the civic center and then just being able to feed them, get them clothing, basic needs, etc. And Rotary stepped up, and as you probably are aware, a lot of that stuff was collected at the Corner Connection with lots of community dollars into feeding those people for 10 days.
So what was not flattering?
Well, nobody really helped them. I think that building is managed by a management company, and it was difficult, I think, finding sometimes housing for those people while they were out for 10 days, and then moving them back in without much attention to whether or not there was mattresses or whatever that was damaged by the roof coming off and not necessarily cleaned back up.
So I'm sorry, who was responsible for that? though?
Well, I honestly.
Like, it's not the nurses.
Oh, no,
So we
no,
Yeah.
were there
I
the
don't
day
think
of
that's- yeah.
at the civic center. We weren't involved after that.
after the fact.
Yeah. We weren't even aware
Yeah,
that someone needed our help after the fact. That wasn't a request that came.
Well, I think that's a part of the problem of the slip there, that, what do you do with these people that basically need lots of assistance and obviously need to be fed and are not necessarily able to go get this on their own?
So who was responsible for that?
I honestly don't know that answer, but I would assume either the city of Charlestown or the management company that manages that building. But Telamon and I think Community Ministries as well as Rotary stepped up with a whole lot of help and a whole lot of dollars.
So in the phases of disaster, the first thing is the preparedness, and then the last thing is the recovery. And your recovery starts at the first instance of the disaster. You're already thinking about the recovery. For sheltering needs, the Red Cross is the lead agency, and they did come and do that. Every step of the way, and this is the value of an after action report. Now, our after action was just amongst ourselves. But the decision was made by the emergency responders that the building needed to be evacuated because the roof was leaking. There was a big storm, and there was water getting into the top apartments, which affected electrical and HVAC, and it was a hot week. So they had about 90 residents. About 40 of them were able to go with family or friends. It's my understanding. The others went that night to the Ranson Civic Center, which was fairly close, had been used before it was available. Just a trailer, they brought pots for everybody. We got a call at midnight that did we have nursing staff who could help. They were checking with the hospital first. And they got a call back from them, and the hospital did have nurse and aides go over that night. Then we came the next morning, the hospital provided this critical support. The nursing assistants were the most crucial. There were no injuries involved in this, so that was a good part, you know, for us as we had all the other logistic issues to work with. A lot of times with the sheltering, it's actually very simple needs you're meeting, but the person can't meet them themselves because their whole life has been disrupted. So all these people were able to take care of themselves at home. But if you're disabled, how you take care of yourself, how you shower and stuff like that. So our role is we were able to provide some staff to be there, as well as some assurance that the department and professionals were physically on site. We also were able to help connect some other agencies that work what was being thought of first by Red Cross. So some of this other social service agencies, they quickly wanted to get people out of the gymnasium and into, so that first day, first 24 hours, they were to get about half of them moved to local hotel rooms. And then the next day they moved the rest of them to motel rooms, I think in Berkeley County. My understanding is that was paid for by the management company. I don't know that for sure.
That was my understanding too.
Meals during those 2 days of the sheltering were provided partly by Red Cross, partly by donations from either restaurants or other community agencies that came together and did it. There were, but then we were uninvolved after that. But my understanding is that how those needs were met for the individuals who were scattered over several hotels in 2 counties, as far as getting their food, was a little less clear. Then we were not involved then in deciding is the building fit for occupancy and all that. We would only be involved if there was an environmental health question and someone brought, say one of the residents said we need the health department to have inspected, but we would otherwise be part of that as the building inspector. All that.
I am assuming that the city of Charlestown supposedly inspected it.
Yeah, they were very involved. The mayors, lots of elected officials, came by to visit. We learned a lot. If you do this all the time, you learn a lot every time. For us, it was a valuable exercise, especially because there was low pressure and that there weren't
Casualties or-
casualties and
Yeah.
hard things. We had a lot of different partners who were together. But it raises a ton more questions, and so now we're in the preparedness for what do we do next time. We've already made some internal communication issues, which there always are. The Red Cross suffers, that these rooms used to be there, they're regionalized so that the Eastern Panhandle and Washington County and Frederick County, Virginia are now, it's part of a region, and the office is in Hagerstown, but they have 40 or 50 volunteers, but only about 30 who are really active. And that's what they suffer from, because they're the ones that respond if there's a fire at 2 a.m. and people have to be evacuated, but they don't have enough lay volunteers. Something to be thinking about it. And a lot of this is very basic human needs. So that's something, how we meet those needs is falls through the cracks.
Well, I think there was a tremendous response from community ministries and Telamon and Rotary as well, with a place to accumulate all of this stuff. And fortunately, Rotary had some emergency dollars that we hold back basically for things like this, and had to have an emergency decision by the board to expend those funds. But some of this was just, basic foods and basic needs that they needed, and, that they would, I'm not even sure how they were transported there to actually get those things, but they were feeding them several times a day, and the ability to take food home with them or wherever they were staying.
I think you know, to be able to feed them and provide that, and that's an amazing thing that we can actually do, right? But I think with the issues that we've seen, right? That's one of those issues where trial and error, we don't have this often, right? We don't have these emergencies often, thank goodness. But these are areas that we can, as a community, kind of discuss and see for the next thing. And unfortunately, you know, our limitation within that realm of the emergency, you know, are those limitations, you know, with the,
Liberty has a function, I mean,
Yes,
that's the whole thing, so
and
thank you to your
Thankfully,
team.
the
for what-
Rotary Club is one of those things that can step up and do all that stuff on that.
Yeah, there's always there's a handoff to, again, the emergency response on site at the
Well,
moment.
and I,
And our responsibilities and the team's responsibilities versus other agencies that are
Yes.
responsible for beyond.
Has there been any talk about a community level AAR?
No, I do believe that there was, a meeting with, was it the Rotary Club and a few other, the community had a meeting afterwards, I do believe. Trying to remember.
Well, there was, before
I think it
Before
was,
they opened the apartment back up, there was concern about whether it was ready and, you know, last minute notification, I mean, joined it. When actually it had ended, because I didn't have the notification. But it was more ongoing concern, you know. It is helpful for, community members to call in and request things from the health department, as opposed to us sticking our nose in where we don't have a legal authority to be there till requested. And, you know, so the collaborating with other agencies can get messy, whether it's the World Trade Center or whatever, who's got jurisdiction. It's the health department's role in different emergencies. Pretty quickly, health department issues become involved. Prolonged power outage, water is refrigerator unit. So there are a lot, and then we are also the ones that are supposed to know how to take care of the vulnerable, medically vulnerable. Certainly includes some more people in Charlestown. So that's something that we can, we're actually charged with sticking our nose in.
Well, thank you again to the team. Shoot,
thank you for
the
what
quick
you did.
response.
So, I did want to mention about vaccines, school season's coming up. So we're starting to see more and more vaccines, being needed. We had hosted a clinic last week. It was actually pretty successful. We were booked full at all time. We were open from 9 to 2, and the school had sent out, their text message, 5 minutes before our deadline was to register.
Oh,
So at the last minute, our nurse, Sherry, she sat and still got most of those patients as much as she could onto her schedule, which made it a full schedule. So it was very successful. We have a second one coming up, September 13th. We'll be again in Charlestown downtown. And we had a few people walk in asking, we saw that, can we still register? And we had to tell them to call the clinic because we got a review. But it just goes to show that, you know, if we were downtown, we would definitely have more people utilizing services. So it was definitely a well-utilized of our resources to set up the vaccine clinic downtown. And then the third point I did want to just say was that for my OBMAT program, the MAT addiction program, we've started to see some patients. And so far, we're still working through the kinks of running a program, establishing it. but the word is slowly getting out. We've been relying on verbal. And I've gone to a few places talking to agencies, pharmacies and urgent cares to talk about that we have a program. So we're slowly starting to see some movement in there as well.
Thank you.
So we did get $20,000 from the Board of Education, which they've been the last few years giving to us from their, I guess, their bond. And that's appreciated. We do work intermittently very closely with their school nurses about a host of different things. So during COVID, it was multiple times a day, and now it's not even monthly. But this time of year, it always is with the vaccine issues. The Charles Towers we talked about. Alexis went to a training several months ago, and I went to one with the medical resident last Friday, I think it was. It's a reunification training, and this mostly talks about if there's a school event, assaultive behavior or something where you have to evacuate students, and then how do you reunify that with the parents, their families, when you have to do it in a secure manner. It can take many hours, and so there's an organization that conducts these trainings nationwide, and very good training about how the different agencies work together, and it's it's not a cookie cutter approach, but it similar to some of the Charles Towers issues of, what do you do? What are your different roles? And so we would have a role in that, and everyone thinks in terms of school shootings, but it could be all sorts of other evacuations and reunifications. Coming up this month, the African American Festival's next weekend. Usually have a booth there. And provide just education, give out some Narcan, some other things. And then the county fair starts next weekend also. We have a booth there in the first Sunday and the Saturday that's the end, and then the evenings from 3 to 7. So come on out. We don't always get prime spots. Sometimes it's back in a corner off the pathway, but it's valuable. People to see us. And, otherwise, nothing real special going on.
Thank you.
Oh,
Anything else?
So piggyback off of the tower issue, with Fair Prep and everything, the nursing staff, everybody did an amazing job. It was great to see JCCM, WVU Medicine, everybody kind of collaborating on that effort, for what needed to be happening. We worked with the VA to help the veterans who were displaced, find locations as well. Which was interesting to get the VA out there, sometimes it's a little harder to do that sometimes. I shout out to all of our sanitarians are doing amazing work. Everybody is busy, our nursing staff. It's a school season, right? We're seeing up to date. Sherry has done an amazing job setting up this vaccine drive this past weekend, and then I can only imagine how much the increase in the busyness of this next one on the 13th. And I know that she's going to do an amazing job with that one as well. All of our staff, everybody has been doing great. We are kind of moving offices slowly. Actually, we will be in the offices right behind here. Some of us will be, to include our financial accounting, Wendy, so it makes signing checks easier after Board of Health meetings. So those are kind of some of the big updates that were just the things that are going on, things that we're seeing. Everybody is, like I said, rocking. We actually got it. Did you want to tell them about the award?
I just remembered it.
I know, I saw, I was, did you want to tell them?
Yes, I will tell them. I'll share the other good news. We did get awarded the West Virginia Indoor Air Radon Grant. It begins in October. It's a $10,000 grant to allow us to promote radon testing, awareness, education, and it will help me recertify as a tech so that I can start to offer radon testing in Jefferson County through the health department, which would be an amazing service that they will help us to get jump started here, help me get my certification back up, and we can kind of build that program out and start to offer it. Hopefully, I want to say closer to December. January is Radon Awareness Month, so I'm hoping that they'll all be ready to go and we'll be able to just kick it off in January for all of the residents.
So they were giving 2 for the state, 2 counties for the states.
And there was a total of 4 awards.
Okay.
Yes.
The,
For $10,000.
and why did we, what were the points that you gave that we should get one?
We received special preference because we are the highest designated risk zone through the EPA. Over 50% of homes test high for radon in this county. I know it is very high. If you didn't know, radon is the second leading cause of lung cancer. It leads to thousands of lung cancer deaths a year. Obviously smoking is number 1. If you are a smoker and you have radon, then it's, double jeopardy for you, unfortunately. So
Is radon typically, like, I always think of radon as, people that have underground basements, not, completely underground, not, open
Yeah.
backyard kind of access. Is that correct?
So we test in the lowest, what we call the lowest livable level of your home. So sometimes even if you do have a basement, if it's unfinished, we won't even touch it. We'll test on your main level.
Okay.
And we do get high readings in ranch living houses. I've been in apartments that have come back high, mobile homes. So yeah, it certainly tends to be a higher risk the lower that you go to the ground. So usually the lowest level is going to be the highest concentration of gas in the home, but that doesn't mean that you're necessarily safe if you are in a ranch or if you're in an apartment, for example. So that's a big push for me as an inspector to try to get that information out there because a lot of people don't know that. So
Will we sell those kits or would they be free? How does that work?
yeah, we'll be able to purchase them through the grant and then distribute them for free for the citizens of the county.
On top of that, like Dr. Reedy was saying, the radon, strictly shout out to her like this. She wrote the grant, everything, I submitted it, that was it. She did an amazing job with that and helped warrant that $10,000 that we were able to earn. One of 4 counties or one of 2 that got 20, but no one got 20 apparently. So we'll take 10.
Put it in her inbox on Friday afternoon.
Yeah.
Due Monday.
Yeah, yes. But on top of that, like I said, busy season for outreach stuff. African American Festival. The fair's coming up. QRT is having West Virginia Goes Purple, and then Save a Life Day, all coming up within the next month and a half. We just hit National Night Out, which is a big outreach night typically as well this past Tuesday. So it's the busy season for everybody. And so you'll see us going and doing a lot. So if you see us out, say hi.
I mean, while you're at the county fair, you may want to have a sign up sheet for people, anticipating the radon programs, if you want more information this, coming soon, but maybe people it's a passive thing, but something that you can collect information and so forth, so.
We'll definitely be bringing our handouts. We already have a bunch printed. So it'll make it easier to start those conversations and then we can start doing the collecting information and be able to send some information out to the multi-race later this year down.
Very good. Any other questions for Brandon? or any questions for Brendan? All right, our next meeting is scheduled for September 12th. That concludes our agenda. Is there a motion to adjourn?
I bid we adjourn.
All right,
A second?
no discussion? All right, all those in favor say aye.
Right.
Aye.
We could,